So good evening and welcome, everybody. Thank you for being here this evening. Really appreciate it, for understanding and using the Portuguese health system. And we have with us Serenity's Michael Averbukh. Good evening to you, Michael. Very good of you to be here.
Good evening, all. Actually, you said it's a record-breaking webinar. I've never been in such a large one, so I hope I can accommodate all your questions and maybe answer part of them even before you ask. So very happy to be here. Thank you very much.
Thank you very much. And we had a great chat before we started tonight, so I'm sure you will. And you have a unique perspective as a medical doctor and as an expat. So you've come into the Portuguese system and seen a few things that I think, in your opinion, might need improving or facilitating. I'll use the word facilitating because I think that's what you do essentially at Serenity. But you tell us, could you give us a brief description of the work of Serenity, please, and how you came to launch the idea?
Yeah, well, I'll tell you a small story about myself and my managing partner. Her name is Rita. She's actually Portuguese, so this is why we kind of excluded her from this webinar. I'm kidding. Yeah, the story is as following. I am a medical doctor, as Carl said. I am from Israel originally. Then a clinician for very long years back in Israel, and then a manager back in Israel, and then left the country to manage some Israeli healthcare projects on the African continent. Done that for more than a decade, when the last one of them was in Angola, and this is where I actually came to meet a lot of Portuguese colleagues. I managed this hospital, and we had the vast majority of expat team was from Portugal. So understanding, first of all, the people, and then understanding a bit the system. And after completing a lot of years on the African continent, I said, okay, need to get back to civilization. Portugal came as almost a natural choice. And together with Rita worked with me in the hospital. She is the best ever manager of client experience. By the way, client experience in healthcare is something very interesting by itself. So we said we should do something in Portugal and started looking into the market. Fortunately for us from a business perspective, and unfortunately for the Portuguese reality, we understood that when it comes to community care, primary care, those everyday needs that every one of us meets, some of us on a daily basis and some of us once a year. But when you need something from the community care, you have a problem in Portugal. You have a problem because for whatever reasons, and we can talk about it during this webinar, this layer of care is pretty, should I use lame? I apologize. But it's really lacking the needed profound care, attention, availability, accessibility for all people. And I'll give you just some sad information. Portugal is a country of 10 million people, give or take. If you guys all move here, we'll be a little bit more. But 1 million of those people do not have a family practitioner that they are assigned to. I mean, they just don't have this very simple commodity. 600,000 of these are living in Greater Lisbon. This is one sad reality. The other sad reality is that if you need to go to your family practitioner and you have one, he will not be available to see you tomorrow. Not after tomorrow, not probably the next week. He will be available to see you, specifically if you live in big cities, in 3 or 4 weeks. And when you look at this system, by the way, behind that, those physicians that are working, that are available, that have the possibility to see you, have accept from you around 1,800 other people trying to get to them. So when you get to a physician, he has like 3, 4, 5, 6, 7 minutes for you. And maybe it's enough if you're a young guy that just wants an approval for the gym. But if you have any kind of problem that is just more than a simple cold, you'll have an issue talking to your physicians. Mm-hmm. So this is what we have discovered. And we decided at Serenity that we will actually facilitate the lives of people that in need of this community care, of this primary care, and we will create for them an operational platform. Operational platform. This is not science fiction. This is not applications over the web, whatever. Just operational solution of access to better primary care.
Okay.
That's it. Sorry for the long
No,
introduction.
that's a very comprehensive, and I like your directness. Looking forward to more of that this evening. So when did it all begin, and what's included in what you would call, under the umbrella of Serenity for clients?
So we started the company. Actually, the thought of the idea was raised prior to the COVID. So we had a long time of thinking about it, unfortunately.
Yeah.
But we practically started the company at the beginning of the year. And having said that, we have served so far several hundreds of people that became our members, the members of Serenity community. We spoke to thousands of them. And what we actually do is, as I said before, just create a tailor-made solution for each and every one that kind of chooses to become our client. This might vary from somebody that just is a member of Serenity community in terms of case management. This is the very basic layer of what we provide today. Just an advice, in a way, medical advocacy, just taking somebody by the hand through the system, of which we're going to talk in a second. Yeah. And up to a fully deployed home care for people that are debilitated, that are bedridden or home-ridden, and they need almost up to 24/7 assistance with auxiliaries, with nurses, with physicians, physiotherapists, psychologists, nutritionists, etc., etc., etc. All of this comprehensive scope is sitting under the umbrella of Serenity, and each and every solution at the end of the day is personalized.
Excellent. Okay, folks, you can see from the chat there, I've put the web link in, serenity-portugal.com/pulso and -en, if you would prefer it in English. You might want to practice.
That's actually, sorry that I'm interrupting you. This is a landing page for the basic layer of case management. But from here, you can go to the site and see all the rest.
Okay, and a very good value. I see you offer packages from €5, and so that will be good to talk about more. But obviously, the more comprehensive services, they'll be more expensive. But it's great to know that you can get access to that without having to engage with long waiting lists and the bureaucracy you described here in Portugal. So excellent. Great stuff. What would people get for their €5 a month, for example? Where does it begin? What is the basic cover? Because some people are thinking to themselves, hold on a minute, I've got medical insurance when I come to Portugal. I've been told to get medical insurance because it will augment and supplement and complement the existing public health system. Isn't that enough? I think there's a bigger gap that you foresee here, Michael.
Absolutely so. And this is an excellent question, because what truly happens for expats, with expats actually, or even with local population. People tend to think that while having a medical insurance, I'm pretty covered, which is, by the way, that's the truth. When it really comes to something very serious, because when it comes to something very, very serious, except for the medical condition that you will get to be treated with in the hospitals. And by the way, the system in Portugal is a good one. You don't have to be afraid from the professional level. Mm-hmm. And if something really, really serious happens, you will be treated very well and the insurance will pay for that. That's great. The thing is that fortunate for all humankind, the vast majority of time, you don't need a liver transplant on a daily basis. Nor do you need an open heart surgery. The vast majority of time, you have your issues with your blood pressure and with your sugar and with this and with that and the pain in the knee and the osteoporosis, etc., etc. And those things are the nagging things that actually harm your quality of life. And for this, you need the system to work for you.
Yeah.
What actually happens with medical insurance is the following. This card that you have, the card of medical insurance is your financial enabler.
Okay.
But then you need to know what to do with it. And I love to give an example of a car. Imagine that you have a great car and you have to get from point A to point B. You know the address. And then the medical insurance is the fuel in your car. So it enables you to go from point A to point B. And yet you can go from point A to point B in a straight line if you know the way, or if somebody guides you through this way, or you can go around. You can waste all your fuel on the way because you just don't know where to go. You turn in the wrong turns, you get off the highway at the wrong exit, and then you find yourself without fuel and you haven't reached your destination. This is exactly what is using medical insurance without the case management.
Yes.
You will spend all your money, all your plafond, what is called here, and you will not get to the solution. Mm. That would have been solved if you had a good family practitioner. Lo and behold, this is exactly where we started. You don't have it.
Absolutely. Yep. Yep. With the comparison is being made that Serenity is like a navigation, like your GPS in terms of driving. Okay, there you go. Thank you, Matty, for that. Okay, so how does it work day to day then? I understand that, and I do get it that you can feel quite protected with medical insurance, but you've showcased the need for something in between, which we can call now client or case management. So how does that practically work? I mean, do we need to come and see you once we've signed up? Is that how it works?
What actually happens is that we come to see you.
Oh, okay, even better.
Yeah. So after adhering, or actually after calling us, you will be assigned a case manager. This is it's always a medical professional, nurses, practically, that will know you, understand your needs, and if needed, will even come to make an evaluation at your home place. I mean, the most problematic cases, somebody that is not only hypertensive or diabetic, but with some debilitating situations and specific needs, we will come and evaluate this person at his home. Mm. And then we will at least know, first of all, who are you? What are your needs? Where are your limitations? Which insurance do you have? And you will be on our database. Whenever you have an issue with the system, whenever you have an issue with your health, whenever you have a question, whenever something happens that needs clarifying or help or assistance or guidance, whatever, with your health / your health insurance / how do I cope with the system? I got just something weird happened to me. Call us immediately. And from this immediate moment, you will have your companion taking you actually by the hand through this pathway of coping now with the new condition that just came up. It can be really only helping you with the bureaucracy. It can be only telling you, you know what, you really need to see an orthopedic surgeon, and the best one for your condition is sitting in hospital A and B. Does your insurance cover that? Yes, we will help you. We will schedule your appointment. Sometimes if you need, we will even come with you and translate to you if the doctor doesn't speak English. By the way, we do it in English, French, and Portuguese for the time being.
Okay.
But more than that, if there's a medical condition that really needs assistance in taking a decision, there is a whole medical team behind it. So if there is a doubt, which doctor should I see now? Which are the tests that I should do prior to going to the first doctor? Our medical team will handle that. You will be handed the prescriptions or the referrals for diagnostic tests even prior to your first visit with your doctor. So you're coming in a way prepared. You don't have to go to a doctor. He will give you the referrals. You will go back, do the tests, come again. We're saving here a couple of days, if not a couple of weeks. We will guide you to the best of physicians. We will guide you through the most efficient and short pathway to the diagnosis, and after the diagnosis, towards the treatment. I hope I'm being clear, but again, we will open for questions, and then we will understand if people tag it.
I think this is fascinating. I suppose criticism of the modern medical system is that it's quite industrialized and monetized. And the person who loses out in that is the individual. So this would see a return to person-centered medicine. Am I right?
Absolutely so.
Yeah. And this, I think, is great news. I mean, you can come to Portugal and you can get that person-centered and even holistic approach to medicine rather than being a number. Because, we have recommended to people that they get medical insurance. And I need to ask, this, you're not a replacement for that, are you?
No,
you're the facilitator of it, because I know with some medical insurances you can ring a helpline, but they're not going to be necessarily championing for you as an individual in the way it sounds like you might be doing, Michael, at Serenity.
Yeah, all the insurances, by the way, local and international, would have a support line. But this support line, and this we cross-check it like hundreds of times. The support line will tell you, hi, hello, Mr. This and that. What's your policy number? Great. And after assuring that you are a client, they will tell you, well, what do you need? That's the first point. I don't know what do I need. I just unwell. Yeah, but where do you want to go? What do you mean where I want to see a doctor? Which doctor do you want to see? And then you become your own GPS. Well, I thought of a cardiologist. Okay. The closest cardiologist to where you are at today, and he works with our insurance, is Dr. Diogo whatever, sits in hospital X. This is an important support line, but this is not enough. Mm-hmm. This is, okay, so where you're at, the closest clinic is this. But closest clinic of what? What do I do next? More than that, we spoke here about a lot of kind of pre-clinic or pre-hospital, whatever. Imagine what really happens after you've been to a doctor or a clinic, or even, God forbid, you were hospitalized, you were operated, etc., etc. The minute, guys, that you walk out of the door of a hospital or of a clinic, you're again alone. Mm-hmm. And this is where we come handy. Just call us and we will help you. We will help you really to ask questions, or actually to answer questions that maybe weren't answered during your consultation. When you walk out of a door of a hospital in which you had a knee replacement, just for the sake of this example, you had a knee replacement, the surgery went very well because, again, the doctors are pretty good. You walk out of the door, you need physiotherapy at home. You know what? Your insurance even covers it. I'm sorry for being so direct. Go and figure that out in Portugal. No way you're going to do it. Okay. I mean, maybe I'm exaggerating, but you'll have a ton of problems finding a physiotherapist at home or near your home that would come and will attend you in the proper time, etc., etc., etc. This is a problem of the Portuguese system.
Okay, and you see yourselves as the solution to this difficulty of the theory, which everybody gets and hopes for, that it will go well, but the practice, in your experience, is something different.
Yeah, it will not go well. It will be covered. It will be paid well. You will not have a problem with payment. You will not have a problem being attended, because if you're not attended even in the private hospitals, you will be attended without questions in the public service.
Yes.
If you have a myocardial infarction, there's no chance that you will be thrown out of a hospital because you didn't bring your car.
Yes.
Okay? This is not the States. And yet, after that, you're literally quite alone.
Okay. All right. So we understand the problem. And so we have some interesting questions that have some sort of universal global appeal among people here. I think this is part of the problem you might be speaking of. Susan asked a great question. What's the best way to ensure medical records get into the right hands in Portugal? And how would you as Serenity get access to those records, Michael?
So this is certainly a good question. Unfortunately, Portugal does not have a central medical record. So everything... If you go to certain public hospitals, they will share your record between them. Otherwise, nobody will know anything about you. This is a major problem. Hence, by the way, you have repeated tests, repeated exams, repeated CTs, MRIs, repeated blood tests. Everything is repeated because nobody sees your previous record.
Okay.
In Serenity, we can ease it up a bit because we have our own medical record, as long as you share it with us. So we don't perform miracles, but if you share it with us and you've been our client for long enough and we have your history and your latest test, whatever, we will not let you perform again an unnecessary CT or pay for unnecessary blood work that the doctor just sent you because he didn't know that the previous physician just did the same.
Okay.
So again, we are limited as well. We are not, I'm not presenting here a miracle and a solution for everything, but it will for sure keep you from unnecessary tests, procedures, blood tests, spending money, spending time, etc., etc.
And you know the right questions to ask, obviously, over and above the lay understanding, of course. Okay, so there you go, Susan. I hope that answers your question. Let me know if you need more on that. This is great if you have a serious condition, says Khadija, that you need care for. For those of us that are going to use the SNS on our own, the Portuguese health system, will this webinar cover that process? Well, in a way, it's not that difficult to, in theory, and this is what we're talking about here, aren't we? The difference between theory and practice. It's not like, we go to our forum and people will give you their experiences, Khadija, of how they've enrolled at a local health centre. I don't think that's that difficult, not rocket science. But the problem you're solving here, Michael, is what happens after that, right?
Yeah. The problem that we're solving again is this: when you have gone through the registration into the SNES, what it's called. If you go through it, it takes a while, by the way. In brackets, it's my personal problem. I'm here for a year and I'm couldn't get through. But leave that alone. The thing is that after you have your inscription, or you are registered in the system, you will have to be assigned to a physician. This also happens to be a problem sometimes. I live, as an example, I live in Alvalade in Lisbon, and my Posto de Saúde, my health center, is quite near my home. So when I went there, they refused to talk to me even. They said, we do not register new clients. So I said, okay, so where should I go? Well, you have to go to the central that is a bit further. So whatever, it's like 15 minutes drive. And then you come there and it's totally crowded, and go figure again. And this is where we come back to what I started with. I just need to see a physician. Great. You have it in 3 weeks. Yeah, but I need him like tomorrow or 2 days from today. No, sorry. We can't. You don't have we can't arrange for an appointment, which ends up quite often by people giving up and going to the emergency rooms. And then what you have in the emergency rooms, you're not an urgent patient, so you come there, they are obliged to see you. You sit there for 6, 7, 8 hours or through the night because you had some minor issue that could have been solved much prior to that, maybe even without a physician, without the doctor seeing you. Mm-hmm. And this is exactly where we come handy, because we will do the first intake, the first triage immediately. You will not have to go anywhere. We will talk to you over the phone. A nurse will talk to you over the phone and tell you, if that is really, really urgent, go to a hospital, go to a hospital. If it can wait for 2 weeks, it will tell you it can wait for 2 weeks. You want to see your physician? No problem. You want to see somebody else? Also no problem. If it cannot wait 2 weeks, we'll tell you, look, you really need to be checked by a physician. More than that, by a physician X, cardiologist, orthopedic surgeon, neurologist, whoever.
Yeah.
And you will say, okay, actually being an expat, you will say, I have a good medical insurance. We'll say, great. Where do you live? Where do you want to go? We will assist you. We will get you to the most appropriate physician that for your problem, because we already understood that. Prior to that, we will even send you a prescription, say, you know what, it's better if you come to the doctor already with blood tests or whatever, with an X-ray, with a CT, with an MRI. We will give you a prescription for that. We will take care to schedule for you, or at least advise where is the closest, more efficient place to do this test that we're aiming to, or where should you see your physician according to your health plan / health insurance, and we'll guide you through it.
Okay,
this
great.
saves you quite a lot of money and time again.
Yes, and puts you closer to the end of preventative medicine rather than acute medicine, which is I'm sure will be very reassuring to people tonight. So Khadija, we won't go through the nuts and bolts of approaching your local Centro de Saúde, but I will do that on the breakfast show. Okay, we'll make sure. We'll have a step-by-step on that, and we'll cover that. Maybe we'll get Anna in, or somebody who's used the system all their life, and to show us how to do that. Okay, so we will cover it, but it won't be tonight. We're finding out more about what Serenity do. Michael Averbukh is here, a medical doctor and founder, or part of the founding team of Serenity, who are really helping close this gap that Michael and colleagues have seen in the medical system here in Portugal. So next question then from Valmuk G. How many current clients do you have, and how long have you been in business? I mean, we heard that you've been trading for around a year or 18 months. Right.
No. We started activity at the beginning of 2021. Okay. Actually starting commercial activity in May, and we have several hundreds of clients.
Okay, and I don't know if Valmuk G is alluding to a sort of capacity, how that works, but presumably you can keep recruiting good doctors because there's no shortage.
Absolutely so.
Right?
No, there's no shortage of good physicians that actually are looking for an extra buck, if we can say that. And in the case management area mainly, nurses are the ones driving our business, and you have enough very well-trained nurses in the country. I mean, that's the funny thing about it. I mean, the country in terms of human capital, human professional capital is great. You have great physicians, high level of professionalism, great nurses. Everybody's willing to work. Of course, they work shifts, etc., etc. But then again, the system in a way prevents the better utilization of such great resource.
Yeah, excellent. And
so we will just recruit more people because all the practical operational platform is done, is ready, and we can expand in no time.
And on that note of great Portuguese professionals, so those in Britain will remember part of Boris Johnson's team when he was struggling with COVID-19 in hospital. There was a Portuguese nurse, I believe, famously in that team as well. So superb. I did mention the word holistic earlier on, and Matty asks about non-orthodox providers. So, I was talking about person-centered medicine. Wouldn't it be great to see a better return to that approach in our society? I use the word holistic as well. What's your scope there, Michael, in terms of what treatments you acknowledge and recognize and would include in somebody's case?
There's a specific statement that I have to do. The idea of Serenity is not to replace the treatment system, just only to help you through it. One. Two, on the layer of how do we look upon complementary medicine or the non-orthodox means of treatment, I am very, very for it. All my life as a clinician, my idea, and this is what my team is thinking most of the time, is that we need to take care of the person. We don't need to take care of disease. We don't fix your blood tests. We look at the person. And if we have eliminated some endangering physiological condition that is treated really by the orthodox medicine, and the person still needs some help, so be it. We'll be more than happy to direct them to any complementary means of treatment, be it acupuncture or be it tuina, massage, Chinese medicine, whatever you want, no problem.
Excellent.
Naturopathic treatment, if that helps you feel better, so be it. Medical cannabis.
Well, okay. Now the conversation just got interesting, and I think a number of those, key phrases and words in there will have had a few ears prick up around the webinar tonight. Great question from Jacqueline. Good evening to you, Jacqueline. Do you work with people who do not have insurance and who pay, I guess, privately when they need treatment? Can you work with somebody like that?
Absolutely so, because at the end of the day, again, we are very person centric. You said it several times, and this is the most appropriate thing to say about us.
Mm.
We will ask you what is your financial enabler? And if you say, guys, I do not have an insurance, I pay out of the pocket money, we will be much more cautious actually. And we will ask you each and every time, we'll tell you, look, it's a good neurologist, but he's more expensive. Mm-hmm. Are you okay with paying, I don't know, 125 euros instead of 90? And you will tell us yes or no. Okay. And we will walk you through it, be it whatever system that you belong to, whatever insurance card you have or do not have. And by the way, and if you just want to enjoy the free public system, great. We will try to find for you a public hospital where you will not pay, and we will try to squeeze you in an appointment. That would be harder for us, but at least we tried.
Good to know, Michael. Okay, so let's get to cost then. What is the investment for this service? How does it actually work?
On the side of the client?
Yeah. How
very simple.
They enroll with you, and there must be a monthly fee.
Very simple. There's a monthly fee. Yeah. There's a monthly fee. There's a monthly fee that starts with €5 for big organizations, but for private people, it doesn't go more than €10, €11 per month. Okay, which is a pretty small fraction of the insurance that you're paying, and that's it. You don't have to pay upfront for 2 years. We don't have this. You can, if you want, pay upfront a year, and you'll get even a discount just for paying upfront. Other than that, you're on our boat, and this is actually our obligation and commitment to serve you in a way that you will not leave, that you would not want to leave us.
Very good.
That's
okay.
It.
All right, but presumably there are other costs as you. I mean, how does it work? You'll point people towards the consultants, or if somebody needed a lot of care, would you manage the case in terms of saying, this is what it's going to cost, and you charge them, or does the end?
No. They don't pay us. They don't pay us directly, nothing, unless using our resources.
Okay.
Okay. If somebody wants my physician to take care of him, okay, so he will pay a fee of the physician at home or not. But otherwise, we just guide the people through the system. We do not charge anything. We do not take commissions from hospitals. We don't do that. If that was the origin of your question.
Well, extraordinarily good value. So corporate plans, by the sound of it, where it might be something like €5 a month, €10 a month for the individual. A question that comes up that I'm sure you'll be able to help with in some way. Prescriptions. People obviously moving country. They want to bring their prescription with them in a sense. They want to keep taking the same medication. Can you assist with that?
Absolutely so. We will see the prescription from the country of origin. We will convert it to the available medicines here, and our physicians will write the prescription. Very easy.
Okay, perfect. And final question for the time being then. We will go to, we'll turn off the recording and we'll go to hands up Q&A so people can ask their more personal questions, but not medical, individual medical questions. This isn't the right environment for that. But do you handle dental and opticians as well? Because often that's left out. Well, it's not included in the public system. So do you help people find access to dentistry and ophthalmology?
Ophthalmology, yes, because ophthalmology, not optometrics, but ophthalmology for sure, yes. This is a pure medical specialty, and there are problems, all around. So ophthalmology, absolutely so. Dentistry, a bit less. I have to admit, we are not very well yet, at least familiar with the dental market. There's a huge amount of dentists. I would say that I wouldn't risk to tell somebody, this dentist is better than that one, and this is more appropriate, because our team is mainly clinical medical team. So everything that is pure clinical medical, we're very strong at. Dental, I wouldn't touch.
Okay, very good. Good to know. All right, thank you very much. So the place to go, we will go to Hands Up Q&A in just a moment. But if you could give us that website address again, the best place to jump in and learn more, please, Michael.
Yeah, so it's www.serenity-portugal.com. Very simple.
Perfect. Thank you so much for joining us this evening. Really appreciate it.
Love to be here. Thank you so much for having me.